Welcome to the Pharmacy Leaders Podcast with your host, Tony Gerber. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
Well, welcome to the Pharmacy Leaders Podcast. I'm Tony Gerber, your host, and today we have Dr. Riley Uglum, who has been president of Eye Care Associates of New Hampton for the past 33 years. It's a highly systemized business that operates out of a modern facility, sets the standards for what an optometric practice should look like, and operates well beyond the realm of traditional practice management, combining advanced financial strategies with systematic entrepreneurial wisdom. Dr. Uglum is the founder and CEO of Promethean Ventures, a wealth creation preservation company for private practice physicians. The company also specializes in implementing an automatic revenue growth system for optometrists. He co-authored the book titled The E-Myth Optometrist with Michael E. Gerber. Welcome to the Pharmacy Leaders Podcast.
Thank you, Tony. Glad to be here.
Oh, great. So I just wanted to start off with a question I ask everyone just to give people an idea of where you are. And I gave some introduction, but everyone's entrepreneurial road is a little bit different. Can you tell us a little bit about yours and how you got to where you are today?
Yeah. Basically, where I'm at today is I can get up every day and be productive with things that I want to do, the things that I have a passion for, rather than having to show up as an employee. And sometimes we think we own our own business, but if we are the only owner or the only person that can do the professional work, like a physician, we take a vacation, we quickly realize that we basically are a slave to the practice. So what I've done and have coached other people to do is move yourself from being that employee in a business. It doesn't matter what business it is, and transition from working in the business, is what we call it in E-Myth terminology, to working on the business. And I still work on my business, even though I only see patients half a day a week. I still make passive income from working on the business, which is basically more lucrative at this stage than working in the business, which I still do a half a day a week, and I get paid as an employee optometrist. But now I can focus on some of the passions that I have, such as therapy dog work, traveling, things I don't get actually paid for, but I'm making the passive income by properly structuring a business in an E-Myth format and working on it instead of in it.
Okay. Well, often when somebody comes out of school, they're looking for a job, but the dream of entrepreneurship may already be in them. We talked a little bit in the pre-chat that there's a way to maybe get a practice to somebody that doesn't have a ton of money coming out of school, but certainly has the drive to succeed. Can you talk a little bit about transitions or how someone would transition to a practice that's already systematized like this?
Yeah, I'm actually doing that with my young partner, and it's kind of a complex formula, but traditionally when we sell a practice, we get it appraised. And in the optometry world, most good practices are usually appraised at somewhere between 60 and 70% of the average of last 3 years gross earnings or receipts. And really, a practice should be based on the income it produces in the future. So the way we've structured this is I get paid for selling half the practice over a 10-year period. I get paid a percentage of what the practice continues to produce. And that gives me a lot of incentive to work on the business yet, instead of just, taking off and traveling the world and saying, here's the keys, good luck. So there's some incentive for me to stay in the practice, working on it, doing some marketing things, some admin things, helping this partner do what I did, because I get paid as a direct result of my efforts there. If he continues to grow the practice and is successful, then I will continue to grow the amount that I'm getting paid for selling that practice. He has incentive to do the same, to grow the practice, because as part of this formula, he gets he gets money paid to him, which he in turn takes part of and pays to me for buying the practice, but he has a lot more left over. And then there's some built-in safeguards, and in the event that he becomes a meth addict or whatever, or if I become a meth addict,
okay,
there's some safeguards built in, so each of us can get out of that agreement. But if you talk to him, I think he's extremely happy. I'm extremely happy with the arrangement. And we did not do an appraisal, which oftentimes costs $30,000 to get an appraisal done. We didn't do that because I'm going to get paid based on what the practice produces in the future.
Well, tell me a little bit about, and I think this may have come from the E-Myth, but about generational, passing on to generations. So, maybe in our will, we have X number of dollars that go to our children. But in terms of a business, I think the numbers are 50% it makes it to the next generation, and then only 10% to the third before it. But it sounds like with what you're doing and the way you're doing it, it's much more likely that the next generation would not only be able to take over the practice, but also continue to succeed and then give it to the generation after that and the generation after that. Can you talk a little bit about giving or keeping a family business within the family?
Well, in my case, both my kids elected. My daughter's actually an oncology pharmacist in Minneapolis. She chose not to take the optometry route, so she actually can't get into the optometry business. You have to be an optometrist to do that. My son's the practice manager, so he's part of the practice, but he won't be able to practice as a doctor. Now he could get into the consulting side if he wanted to, something like that. But in a profession like mine, you do actually have to have the license. But we do teach people how to do a personal banking system, which has also been a huge part of where I'm at right now. And it's called the infinite banking concept. Maybe you've heard of it, maybe you haven't. And it seems a little bit out there, but the guy that taught this to me 10, 12 years ago, that's had a huge effect on my life. And part of Promethean Ventures, we train people to do that type of strategy too. So that is generational. And for example, my kids, my children pay me the mortgage on their homes. I own their homes, and they basically pay me the mortgage, and they're paying actually a higher interest than they would at the bank. However, when I'm gone, they will get all of that back because it's paid into a system, a banking system that we own personally, rather than financing through traditional banks and losing all the interest to someone else. So that's extremely generational in how we do that.
Okay. Well, I think you talk about this quite a bit in the book, where you actually started creating companies to avoid paying other companies and losing on the tax side and things like that. But you don't necessarily have an accounting background. How did that happen, or how did you gain that savvy? Because many people will read books about these things, but how did you start this kind of, I don't want to say maybe it's taxes, maybe it's just intelligence, maybe it's just the way it's set up. But the United States is set up for these things to happen if you do it right. But how did you become proficient at this?
Jim Rohn, who's probably the father of all personal development guys, Tony Robbins and everyone. But he has a saying, he has a lot of famous quotes, but one of them is, you will be the sum total of the 5 people that you hang around with most. That's not his exact words, but basically he's saying, if you hang around with losers, it's going to be hard to make something of yourself. So I've just been fortunate to hang around with people that have already done these things. So I did not create them, but I remember when I first figured out some of it. I was just at a social event with a couple other guys from my hometown here who make a lot of money. They own companies and they make way more money than I do. But I was kind of complaining on the taxes. It was the first time, I made some decent money in optometry, and I had a huge tax bill, and I was kind of complaining about that, figuring they would chime in too, because they obviously paid a lot more taxes than me. But they were just not saying a whole lot. And I finally just looked at them. I said, I'm paying more taxes than you are, aren't I?
I mean, it's not funny, but it's funny.
Yeah, it is. And then that's when I realized, okay, they're doing something I'm not, and I need to find out what that is. And so, yeah, I'm not a CPA, I'm not an accountant, but I've been fortunate enough to be around people who were pretty astute at doing these things, and I just learned from them. I'm just kind of like a sponge.
Okay.
So.
Well, tell me a little bit about choosing New Hampton, Iowa. I'm also an Iowan now. I've only been here 10 years, so people look at me like, oh, you're not from here or whatever. But I bought the t-shirt. It says Iowa. It's got home on it. I didn't say trapped or captive or anything like that, But we look at these kind of celebrity chef shows and we see that, there's this Scandinavian chef in the middle of, a rural area in Scandinavia, and they're, have this great restaurant, charging $300 a plate for 12 people, and they're full for 6 months out. How do you make a practice succeed in what is probably not a very large metro?
Well, I've always looked at that as an advantage. We're the biggest fish in this pond, and we've had other small towns come to us and say, could you do a clinic in our town, like a half a day a week or one day a week? And we've always turned them down, and we built a facility. We have a lot of cutting edge equipment. Part of this banking concept allows you to purchase equipment that a lot of other practices don't have. And so it was kind of like the Field of Dreams concept. We said, let's build this and they will come.
Okay. Yeah.
And that's basically what's happened. So now the people from the other small town, we have people that'll drive 20, 30 miles to see us because they love the care that we provide. And in this one facility. And I also don't have ophthalmology practices nearby. So we can do a lot of medical optometry that people would, if you're in a city, they're probably going to go to an eye surgeon for a lot of this care. And we can do a lot of that right here in a small town. They don't have to drive 30, 40, 50 miles to do that. So the medical side of the practice has been a big part of our growth back in the day.
Okay, well, tell me a little bit about being able to serve the underserved, because it sounds like if you just happen to be in New Hampton, Iowa, you actually probably get some of the best primary care eye work that you would in the state. You mentioned that, other places want to replicate it, but I guess if you are a practice in a smaller town, what would be your first step to maybe getting towards the kind of systems where you could be a regional center? I know that our 99 counties are still set by that, courthouse in the middle of the county where you would, take your horse to or whatever. But how would these other counties that are maybe underserved provide service for 2, 3, 4 counties?
Well, you have to be able to provide the services that a metro area would provide, and there are. Set yourself apart from the other practices. Do things that they're not doing. We recently put in a dry eye spa in our practice. So we built the room. It's like a massage room. We have a massage chair in there, and we actually have an instrument that expresses the oil from the meibomian glands in the lids, which is a very clinical thing. But we do it in a setting. It's more like going to a spa. We have aromatherapy, soft music playing in the background. We actually have people falling asleep while we do this procedure on.
Wow.
But nobody else is doing that.
Okay.
So you just need to innovate. Like Michael Gerber always said, find a need and fill it. That's how you become a successful entrepreneur. Don't just pick something you want to do or like to do or are good at necessarily. When you got 50 other people doing the same thing in the area, find a need and then fill it. So, yeah, I guess that would be my advice for somebody, going into a small town.
Okay, well, let's talk about Michael Gerber and how did you guys meet or how did you guys connect? Just for the background, I've listened to yours and the one by the veterinarian. I believe his last name is Dr. Weinstein. So that's kind of what I have in my background. But tell me a little bit about meeting the E-Myth author.
Yeah, I've always done mastermind groups with optometry. And again, it kind of goes back to that Jim Rohn principle. You want to just hang with people who are doing what you want to do on a very high level. And at one of these mastermind groups, somebody was talking about E-Myth. I'd never heard of it. And so I investigated it, and actually in Des Moines, Iowa, I don't know if it's still there or not, but they actually have an E-Myth training center. So we signed up with their program, and I had never met Michael Gerber at this point, or never thought I would, but he did what was called a dreaming room thing down in Flagstaff, Arizona, and it kind of intrigued me. So we went down there for a few days with a few other entrepreneurs, and he just teaches you how to maybe do and think of things in different ways as an entrepreneur. And as a result of that, then I signed up for some personal coaching with him. And then that's how I actually got to know him on a personal basis and became a friend of his. And then he came to me with this book idea. And he'd done one other book with lawyers prior to that. I think I was the second or third one that did the book. But it was basically taking E-Myth concepts and then applying it to a specific vertical market.
Okay. Yeah, he calls it the vertical series. I put in my 2 cents to see if I could write the pharmacist one. We'll see how that works out. But I hear that you get some kind of communication maybe a month later or something like that. So we'll see. We'll see how that works out. But I wanted to take a piece of what you talked about in the book. And you talked about adding a product which you don't necessarily think of because you had gotten to the point where you could, and maybe you can explain it better than I, that there's a certain level of antioxidants that you need to have for good eye care. And obviously, as a country, we're aging, and many people want to stop that aging. Certainly with eye care, I have presbyopia. I had to start using the cheaters 3 years ago. Went to the optometrist, and then got my glasses. And so, tell me a little bit about that. That's to some people, it'd say so. You give people vitamins, and I feel like it's much more than that.
Yeah, well, especially in macular degeneration, we were kind of ahead of our time when we did that, and it wasn't really well accepted by our patients in a small town Iowa. It seemed kind of out there for them, but now, I mean, there's tons of studies that show if we use omegas with lutein and zeaxanthin in a supplement, that we are going to be much better off from the standpoint of macular degeneration. It nourishes the macular cells, and it's a preventive way. Eating right, exercising, it doesn't matter whether it's macular degeneration or diabetes or cancer or whatever. But if we take better care of ourselves, it's like, we buy a car and we change the oil at the right time and take care of it, it's just going to last a lot longer. And it's a concept that just makes sense to a lot of us that are health oriented, but and I think it's just starting to make sense with some of the people out there that are eating at McDonald's every day and are overweight and sitting in the recliners too much. So it doesn't matter whether it's eye disease or heart disease or whatever. We're just going to be a lot better off when you get to be my age than if you are not following those basic principles. And supplements are just maybe a little easier way to get the nutrition in there that you should have. If you eat all the right things, you probably don't even need the supplements. But what are the odds of that?
Yeah, I'm not that person that with 3 almost 7-year-olds, I tend to stress eat, so I would need the supplements for sure.
Sometimes you're in survival mode, yeah.
Yeah. Well, let's take it to a little bit of a different place where they've called loneliness the new smoking. And as many people retire, they kind of don't know what to do with their lives. And yet they may be in a position like you are where they have this money, but the reward for having this money is not really having a lot of other people that have succeeded and they're still working. So how do you spend time when you when you have so much passive income? How do you structure a week or a day? And you could travel the world if you wanted to. You've chosen not to, but tell us a little bit about your structure and what it looks like at the end, which they say active retirement, but I don't necessarily think that word means what we think it does. But maybe talk a little bit about what it is to have that kind of passive income and to still be very fulfilled from what you're doing.
Yeah, that's really good, Tony. I think that's really important because I think there's a lot of people right here in New Hampton, Iowa, that I see them I've seen them going to, these guys, they go to the coffee groups every day and talk about the same stuff. I read an article just the other day that it was by Ben Hardy, who's a great personal development guy, but they've got studies that shows as long as your brain is learning new things all the time, you're forming new synapses, you don't age as fast. And I've always just loved to learn new things. So, I've traveled and I've done a lot of that stuff. It's not as attractive to me anymore. I've been more of a bit on the selfish side as a taker, focused on business, making money, that type of thing. And now, due to a series of things, I realize I need to give something back to the planet. So I'm passionate. I do therapy dog work at Mayo Clinic. I do a grief support group for the local church. Still active in the business as an optometrist, but I want to see that business thrive. I don't have time to go to coffee. I can tell you, I'm pretty much active the whole day, and I'm doing things I'm passionate about. So for me, it's more service and volunteer stuff now, and it just makes me feel good inside. I've got stuff, and I've done stuff. And you do the stuff, and then what? You look forward to that vacation. You come home like, okay, now what? So I think you just need to find something you're passionate about, and if it involves helping other people, you learn new things, and you hang around with different people, and you form new synapses, and you just stay a lot younger and more vibrant.
Can you tell me about the therapy dogs? I'm just not familiar with it.
Yeah, well, I started out, 7-8 years ago. I was working with a service dog group. I've always loved dogs, and I've got a couple of my own. And I decided, as part of my giving back, I started helping them acquire dogs for their service dog program. They do dogs for PTSD service veterans, for autistic kids, diabetic detection dogs, that type of thing. And that's fulfilling work. And in fact, and Kathy and I even fostered a dog one time. You do the basic training for a year, and then you turn it over to them for the formal training. And it went to an autistic child. That was very fulfilling. But what I realized is with therapy, with service dogs, you're training a dog to serve one person that has a special need. With therapy dogs, you take your own pet, you put them through a training program that you can basically do yourself. And that dog is designed to go out and spread the love amongst many people. So we've worked at Minneapolis Airport quite a bit in the past. We work at Mayo Clinic, care centers, hospice. So I've got an 11-year-old golden doodle who loves the work. And right now we're pretty much focused on Mayo Clinic. So we go up there a few times a month, and we basically go around to hospital rooms and light people up by letting them pet a dog. And we do a lot of therapy dog for the nurses at the stations too. They just love to see these dogs come through.
I know my kids would flip out. They would absolutely love it. Well, I've asked you a lot of questions. I wanted to see if there's anything that you wanted to talk about that maybe I missed, and maybe especially talking about interprofessionalism, where in schools, they try to put the physicians and nurses and pharmacists in this, emergency case. But it sounds like we could help each other as business people and then just community leaders as well. So maybe, talk a little bit about, as a final note, how can we work together as health practitioners rather than, individuals who just happen to have our own shop?
Yeah, that's a good point, Tony. And maybe it's easier in a small town, but I remember I used to, I would write scripts for meds, and we get an unusual case in, and so I would, back in the days when we used the PDR, and we'd look at the internet, and I didn't want to look foolish when I phoned that prescription into the pharmacist. And now, since my daughter became a pharmacist, she said, "Dad, why don't you just call and ask us?" I have physicians all day long that oncology docs, and they say, "What would happen if I combine this drug and this drug? Is that viable? Should I do that or not?" And I came to realize, so I do that now. If I'm in doubt, I'll just call up the pharmacy. What do you think? And I always in the past, it was more like an island. I got to know what I'm doing before I talk to somebody else. And we do the same thing now with the physicians. I've become good friends with some of the family practice guys here, and they can call me up. They get a weird eye case in the ER, and they can call me. Hey, man, they'll send a picture on their iPhone or whatever. What do you think this is, or whatever? So I think there's more collaboration maybe than there used to be. But I love you pharmacy people. I mean, that is so complex. There's so many new drugs, even in eye care that come out all the time. And we go to lectures, and sometimes if I sleep through part of it, I wonder a little more about that drug. And now I know I can just call up the local pharmacies and just ask them. And I used to feel stupid doing that. And you just can't know everything. There's just too much to know now. So we need to rely on each other.
Yeah, I 20 years ago when I graduated from pharmacy school, the options were limited, and the hospital pharmacist was often in the basement. So I would just tell people, hey, you know what? We're in the basement with no windows. We really want you to call. Please call. Let me have some human contact. And I was probably the same way when my kids were first born. They're like adult repellent until they get a certain age. So, okay. Well, was there anything that maybe you wanted to say before we went off? Any last word? And maybe about E-Myth or anything like that?
I would say just enjoy the ride. Sometimes we get so caught up in running a business, as an entrepreneur, and we try and keep too many balls in the air. And, I've come to the point, you just gotta enjoy the process. We're focused on goals, and that's important, but I think you just need to focus on the process and slow down a little bit sometimes. It's a crazy world out there, and it can just, it can consume us. I've pretty much, I don't look at Facebook anymore, my LinkedIn, very little. It's not that I'm antisocial, but there's just too many more important things to focus on. And you can fall down that Facebook rabbit hole pretty easy. And next thing you know, there's an hour or two gone that you could have done something or enjoyed life a little bit more, spent time with your kids, grandkids, whatever. So I'm still working on that. Sometimes I still get consumed by all the stuff out there, and I am a shiny object person.
Okay.
But just enjoy the ride sometimes.
All right. Well, thanks so much for being on the Pharmacy Leaders Podcast.
Yeah, thank you, Tony. It was good. It was a pleasure talking to you.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Gerber. Be sure to share the show with the hashtag #PharmacyLeaders.